Welcome to our animal care orientation video. We're going to start right at the beginning where you will find out which animals are assigned to you. You will be assigned a primary animal and 1 to 2 holding animals for your AC week. Depending on your AC week, you may be admitting animals from a shelter or animals may be transferred to you from a student that is coming off of AC. Let's talk about admitting animals from a shelter first. If you are admitting animals from a shelter, they will have an animal intake form filled out by the shelter. When these animals come in, I will assign them a Georgian College log number and write it in the space provided. I will also assign a student for each animal and write the student name at the bottom of the form. It is your responsibility that this form is filled out properly and completely. Occasionally, there is information missing or not clear and we'll need to figure it out. In this case, we have color and markings missing, but that is an easy fix. We can just go to the kennel that Fluffy is living in and check to see what color she is. If we cannot figure it out on our own, we will need to call the shelter for clarification. So you will look to see who the shelter is, and you can call them and ask for the missing information. If there is a vaccine or medication that you are unsure of because of the name, you can look it up in the compendium, which is located on the bookshelf. Once you know who your pets are, you're going to go to the kennel areas to see which room your animals live in, say hi, and make a note of the room. You will then come back and pick the binder color that corresponds with the room that your pet is in. So for example, if your pet is in dog room number 2, you will take the green binder and fill in a green binder. First, you will choose a cover page for your binder, pink for girls and blue for boys, and then you will open the binder and fill in all the sections in the binder with blank pages. All the pages that you need for this binder are located in the gray slots on this bookshelf. The last thing you will do is place a sticker on the spine of the binder with the patient name and log number. Those stickers are going to be found in a binder on this bookshelf or in food prep above all the binder slots. The next thing you're going to do is go back into your kennel areas and make an assessment of your patient. For your dog patients, you need to make sure that they have a collar, and if they didn't come with a collar from the shelter, then you will need to go into the cupboard and fit one for them. Each of your dogs should also have 2 leashes, 1 slip lead and then a clip leash. Finally, for all of your canine patients, you need to see the hospital supervisor and pick up a Georgian College Veterinary Hospital tag and attach it to the collar. If you are on discharge, you need to remove this tag and return it back to the hospital supervisor. Finally, make sure that your pet is happy by making sure that they have bedding, water, and food. The next thing you will do is give each of your patients a cage card found in this top drawer. For dogs, you will have laminated sheets which you have to fill out in erasable marker, and there's Velcro on the back that attaches directly to each kennel. For cats, we have these paper copies. Again, choose the right color for the right gender of your patient. Each patient also needs a disposable collar. You will take a Sharpie and write the name of the patient and again the Georgian College log number. For cats, one of these is definitely enough, but if you have a large dog, you may need to combine 2 collars together to fit it around the neck. Remember, 2 fingers underneath each collar is the perfect tightness. Your patients that are canines also need a behavior assessment sign velcroed to the door. We have green for happy and friendly, yellow for cautious, and red for aggressive. It is rare that we get aggressive animals in, but it has happened in the past. If an animal is labeled as red, only staff and the AC student assigned to that patient is allowed to have contact with that dog. If you are unsure as to what color to give your canine patient, you can reference the color code system for canine behavior. These signs are posted on the outside of each dog room. As soon as possible after admission, we'd like you to give your patient a quick check over to look for obvious signs of disease and parasites. Have a fellow student help you. The following areas need to be examined. So you need to weigh and check the body condition score of your patient, mucous membranes and cap refill time, Check ears for debris and mites. If you do find some debris, you need to check it under a microscope. Flea check using a flea comb, check neck and base of tail, hydration status, and anything obvious like lumps or bumps. Once you have the weight of your patient and the body condition score, you will do some food calculations for your patient. In the cupboard above the sink and food prep are a few binders with feeding guides. You will find the food that you want to feed your pet, check the chart, and figure out how much your patient should be eating. Remember, these are daily amounts, so you'll have to divide that by 2 to get morning and evening feedings. Once you have your calculations, you're going to fill it out on the food board with your patient name, the amount of food, the type of food, how often, and your initials. Stickers that you may need for your file live in this binder on top of this bookshelf. Stickers that are in here are things like this animal is not available for adoption, your TPR stickers, surgical and pre-op alerts, and some behavior alerts as well. If there are any issues like ear mites or fleas that are found, you must contact a staff member as soon as possible to get the proper medication, especially if it is highly contagious. When a medication is dispensed, you need to apply it to your pet and then record it in the patient file in a couple of places. First, you need to record the medication in the procedure log and fill in the medical problem list right here. As an example, if the animal has fleas and ear mites and Advantage 10 and Milbamite has been dispensed, you will fill in the procedure log stating the date, the problem, what medication was used, and your initials. Next, you will flip the page and fill in the lab procedure section under ear swab. Again, filling in the date, results, check off that the DMR and lab log have been filled in, and initial. Finally, you will flip to the DMR and fill this out as well. As you can see, we have filled in the findings from a brief exam. Notes on the ear swab have been included, and that medication has been applied, and finally, initials of the AC student. If the animals are already here and are being transferred from one student to the next, you will already have a binder made up and some pages from the prior week. Your job will be to fill in the pages that are needed and make sure all your skills are completed on the patient for the week that you are on AC. To find out what animals have been assigned to you, please visit the front lobby, and posted on the glass wall will be this Animal Care Student Animal Assignment Form. This form will be posted either the day before or the morning of transfer day. Here you will find your name and the animals that have been assigned to you. You will see which of your animals is your primary animal and who are your holding animals. You may have 1 to 2 holding animals depending on the admissions available. At the bottom of the page, you will see the requirements for each animal. Pre-arrange to meet or round with your incoming AC students. Please review the entire medical file after your noon dog walks are done. Incoming students are responsible for any file omissions, medication administrations, deworming, scheduling, booster vaccines, food calculations, and the continuation of care for each animal. Whenever you are running a sample in the lab, you will need to fill out the lab log, which is located in this cupboard, and it's located in this binder. So for all of your patients that you will get, you will need to run a fecal sample, and that will definitely need to be recorded in here. You will also need to record it in the patient file under the procedure log and the DMR. If your fecal sample is positive, you will also need to either contact the hospital supervisor, one of the doctors, or the AC supervisor. For your primary animals, you will also be doing a urinalysis. You need to record that in the lab log, the DMR, and the procedure log as well. If you ever get a lab result that is abnormal and there is no doctor, the hospital supervisor is unavailable, or your AC supervisor is unavailable, you will need to write this down on the clinical notes board in the corresponding room to your animal. If you found a positive fecal sample, you will come to the food prep room and look at the deworming protocol. Here you will find the parasite that you found under the microscope and the medication that treats it. You will then need your patient weight and do full calculations. Once that's all done, you can come and see the hospital supervisor, AC supervisor, or the doctor on duty to get medication for that patient. If the medication is to be repeated and the animal will still be at Georgian College at that date, you can put the repeated medication into a brown envelope, and it is your duty to communicate that to the next AC student to make sure that that animal gets the next dose at the right time. If the animal is going to be discharged to a shelter, then that medication, that second dose, will need to go into a pill vial that will need a full label and the exact date that that shelter needs to give that animal the next dose. You will, of course, have to fill in the DMR that you gave the medication and when the next dose is due, as well on the medication board. So the patient name, the name of the medication that you gave a dose, and when the next dose is due. Again, for any abnormal results where a hospital supervisor, the AC supervisor, or doctor is not available, you will make the notes on the clinical notes board in the room that corresponds with your patient. So each of the cat rooms and each of the dog rooms have one of these boards. So you will write what the abnormality was, your date and time, and your initials, and you will double check to make sure that that has been followed up with. Another one of your duties is to make sure that your animals are up to date on vaccines, and if they are not, you need to schedule an appointment with one of the doctors. Under Vet Tech Organization, under Blackboard, you will find a Google Docs where you will find different dates and times that you can schedule appointments. You are not allowed to miss class for an appointment, so make sure that it corresponds with a date and time that works well for you. Always be early to your vaccine appointment so you can get everything ready and the doctor isn't waiting around. They don't like that. So make sure that your patient binder is ready, that the vaccine certificate is filled out as much as possible, and that you have all the supplies needed. So a variety of needles and syringes, as every doctor likes something different, as well as gauze and alcohol. Vaccines will be retrieved once the doctor is ready. After the appointment, there are 3 places to record keep: the procedure log under vaccines administered, the vaccine certificate with doctor signature, and the DMR, where the sticker from the vaccine vial will be applied. Make sure that the route of administration and the doctor signature are also included. Before the animal is discharged to the shelter, the vaccine certificate needs to be photocopied with the original going back to the shelter. There are a number of things to do before the animal is discharged. First of all, you will get an envelope, and looking at the example, you will fill out the outside of the envelope with the animal's name, your name, and the shelter that the animal is going back to. Inside the envelope, there should be a couple of things. First of all, the vaccine certificate, the original copy, and a summary of the animal's stay here, which is found in the gray slots. The shelter form should be filled out with any lab tests that were done, anything that was diagnosed for the animal, any medication that's going home, any repeat medication that needs to be administered again, and then at the bottom, a little blurb about the animal and their stay here. Once the animal is discharged, we need to write down in the DMR that the animal was in fact discharged to what shelter at what time. This is one of the regulations that we need to upkeep. After the animal has left the building, you will make a permanent file for each patient by getting a file folder from the bookshelf. You will use the number stickers provided to label the animal's file with the Georgian College log number. There is an example here on the side of the bookshelf with how everything should be laid out. We want the stickers to be attached in exactly the same spot so that they are easily located afterwards. At the bottom of the file folder, you will write down the animal name and the shelter that they came from. Once your file folder is done, then you will take out all the pages in the order that they are in the binder. You will 2-hole punch them at the top and then put them into the file folder. Once that is all complete, you will take your file folder and you will file it at the bottom of the bookcase. When you're on AC and there is an admission or discharge with a shelter partner, please be at the clinic to help whenever possible. As an AC student, it is your responsibility to help with putting cats in their kennels and then cage and run cleaning and rebedding if new animals are coming from the same shelter. Please plan to participate fully. If there are no new admissions, then it is your responsibility to take out all the bedding and put it in the laundry room. Put a tag that says patient discharged. Kennel duty will be in charge of cleaning in the evening.